In Unit 1, I'll review with you the following information. Why is it important to learn about language and language development? I'll define the terms communication, speech, and language, which are very important terms for this course. I'll describe the unique characteristics of human speech, language, and communication. I'll define the 5 rules of language, and I'll conclude Unit 1 by describing the typical 4-year-old who in just 4 short years is already a very competent communicator. So let's now start Unit 1, Part 1, and this corresponds to slides 1 through 14 in the Unit 1 slide set. So by means of introduction to language development, we'll be talking about the what, the when, and the how of language development. The what of language development refers to the behaviors that we'll be looking at, and these are language behaviors, speech behaviors, and communication behaviors. The when of language development refers to when these behaviors are developed, and we'll be tracking these behaviors, and they're referred to as then developmental speech, language, and communication milestones. The how of language development is a rather complex process, and it includes what we bring to the table in terms of our biology, our cognitive development, our perceptual development, as well as what we get from the environment. And we'll be discussing the how of language development as well during the course. So why study language development? It's important for anyone who's interested in child development. Starting at birth, development happens. Physical development, social development, emotional development, cognitive development, as well as speech, language, and communication development. Any professional who works with young children should be knowledgeable regarding the sequence of language development. As a professional working with children, you'll be in a unique position to help facilitate their language development. Also, as a professional working with children, you'll be in a position to discuss with parents your concern, or perhaps even the parents' concerns regarding their child's speech, language, and communication development. And you may be the first professional to have this discussion with the parents and to discuss your concerns with them, and to even perhaps recommend that the child goes for a speech and language assessment. So why does a COM-D major need to study language and language development? The big picture is that this course will provide you with clinically relevant information that you'll use as a SLP. And more specifically, the course content provides you with the foundation for clinical practice for both assessment and treatment of speech, language, and communication behaviors in children. For those of you who become SLPs, many of you will work in settings where children 0 to 18 years can be assessed and treated. And some children are referred for an assessment because there's a concern regarding their voice. Other children are concerned for an assessment because there's a concern regarding fluency. However, the majority of children who are referred to an SLP for assessment are due to concerns regarding speech, language, and communication. So you'll be using this information very often as you assess and treat children with speech, language, and communication delay. So, clinical insights for assessment. The more you know about typical language development, the more you'll know about which behaviors need to be assessed, especially for a child of a certain age, when those behaviors typically develop, how to assess those behaviors, and which tests to give, and what behaviors are actually being assessed on the test. So the more you know about language development, the more confident you'll be that your diagnosis of a language delay, a speech delay, or of a communication delay is accurate and valid. So also for the COMD major, clinical insights for treatment. The more you know about typical language development, the more you'll know about the order and sequence of behaviors to teach in therapy. Many of us teach behaviors that are developmentally appropriate. The more you'll know how to interact with the child in the most meaningful way, and the better you'll be in terms of educating parents regarding language milestones and stimulation strategies that can be used at home. Most of the strategies that we talk about with parents are based on what we know that parents do with their typically developing children. So for the COMD major, clinical insights for treatment, the more you know about language development, you'll be able to provide the most effective and efficient language therapy and parent education. So other reasons why it's important to study language and language development is that it contributes to applied research when we ask these types of questions. What's the relationship between language and the brain? What part of the brain controls language? If that part of the brain is injured, will another part take over? Is age a brain injury important for language recovery? So these questions have been asked, and we now have many answers and know much more about the relationship between language and the brain. And the study of language and language development also contributes to basic research by answering these types of questions. What is the relationship between language and thought? Do different languages have their own influence on the thought or thinking and actions of its speakers? And these types of questions are asked and answered by social scientists and sociolinguists. So we are at the end now of Part 1. And in Unit 1, Part 1, you should now be able to answer the following learning objectives. You should be able to state specific reasons why learning about language and language development is important for an SLP as well as for a future educator. And you should also be able to state general reasons why the study of language and language development is important.